primary hyperaldosteronism part 2. In this one, we are going to be talking about symptoms. If you haven't seen my part 1 video about this condition yet, you can go back and find that one, but we're moving on to talk about symptoms. And again, I just want to preface in this video that I am not a medical professional. I am just sharing my own personal experience with this condition and just all the different reading and research that I've done. If you are similar to me and you, when you're encountering a medical diagnosis or really just anything new in your life and you want to know all the ins and outs of it, you want to know every single little detail you possibly can to understand the bigger picture of it, that's exactly why I'm making this video, is because when I was diagnosed with this, I could find pretty much next to nothing. There's one other person on TikTok here that had a pretty nice series talking about her journey and her surgery, and I really appreciate that one. But otherwise, there is not a lot about this condition out there. So I've had to do a lot of research on my own. And it's really good reading a lot of the medical literature that's out there, but sometimes it's also just very helpful to hear real life stories from other people that are experiencing similar things that you are, the same things you are, and you can say, hey, wait a minute, yeah, that's exactly what I've been dealing with too. And like I said in my previous video, this is an underdiagnosed condition, so hopefully this might even help people get an answer faster. Okay, so now we're going to talk about symptoms. So as I said again in the first video, primary hyperaldosteronism is a condition of the adrenal glands where one or both adrenal glands is producing too much aldosterone. Aldosterone is the hormone that regulates your sodium and potassium levels in your body that help with your blood pressure regulation. So one of those symptoms of having this condition is having high blood pressure, and specifically high blood pressure that is very difficult to manage. If it is ongoing, if you're on a blood pressure medication or maybe even multiple and it's still not manageable, that can definitely be an indicator of this condition. Another one was the hypokalemia, which is another way of saying low potassium. And this was one of the very first big indicators for me, because having low potassium produces other symptoms in your body. So for me, and some of the most common symptoms are having a lot of muscle weakness, muscle pain, muscle fatigue, and soreness. For me, I've described that as feeling like, and it's specifically my muscles in my arms and legs. And again, this could be different for other people, but for me, I describe it as I feel like I've done a very hard workout, and it's like now it's like the days after where my muscles are very sore, except I haven't. and really I haven't been able to do hardly any exercise in I don't want to tear up even thinking about it, but I haven't been able to do much of anything because my muscles have been so sore and so weak. Yeah, not fun. It's hard to even carry my baby around. It's hard to vacuum my house. It's hard to do walking on stairs. Basically everything hurts my muscles. They feel very weak. Muscle cramping is also common. Another common symptom is having a lot of fatigue, because again, this is an electrolyte that your body is very low in, and no matter how much you supplement, if you're drinking electrolytes or even supplementing potassium, a lot of times it's still either too low or just not at a good level. Because for me, even with taking 80 milliequivalents of potassium every day, I've still lingered around that low end of normal, and sometimes even too low. So yeah, sorry, I've got kiddos making noise. Having low potassium can give you weak muscles, fatigue. Another common one is having increase in thirst, and then also an increase in urination, and specifically at night, like getting up multiple times in the night to have to go pee. And another one that I've seen, sometimes this is in the literature, but this might be more anecdotal, and just things that I've read from other people's experiences, is having night sweats. And this was one of my first indicators about having this, and I'll share that later in another video. But yeah, the main symptoms, again, are high blood pressure, low potassium, muscle weakness and fatigue, just general fatigue. Another one that can be common is numbness and tingling in the arms, hands, legs, and feet. That's has to do with the potassium. When I'm up on my potassium and when it's closer to the normal range, I don't have quite as much of that tingling, but I can tell when I'm getting low because I can really feel that going on. So yeah, those are some of the most common main symptoms. One other one that I will share, and again, this one is really anecdotal because it's not in the literature, and I've even asked a few of my doctors about this, and they've typically said, no, that's not really a symptom. But I am in a Facebook group with other people that have this condition, and they have expressed the same thing, and a lot of them had this resolved when they had their condition treated. So that is having flank pain. So pain like in this part of your back, either side. But for me, I've had it on my left side, even, like well before my diagnosis. And it was very, very painful, especially during my pregnancy with my youngest. It was horrible. I would just cry with how horrible this pain was. And now I'm thinking that might have even been my first indicator that this condition was happening, because the adrenal gland that is affected for me is on the left side. So very interesting. One thing that I didn't mention in my last video is that often the cause of the hyperaldosteronism and why the adrenal gland is producing too much aldosterone is because there is a nodule, a benign tumor that grows on one or both adrenal glands that's causing too much of that hormone to be produced. So for my case, I have that tumor on my left side, which is where the flank pain is. So again, this is anecdotal. I'm hoping maybe more research can be done into that at some point, but yeah, horrible flank pain. So those are the symptoms, and I hope you come back again for more. We're going to talk about how it's diagnosed, how it's treated, some of the different tests for all of that. So yeah, thanks.